So we'll be covering referral management for population health. So my name is Drew Bajugam. I'm a current rising sophomore at Duke studying computer science and economics.
Hi, my name is Sathik Verma. I'm a rising senior at Milpitas High School, and I'm interested in data science and AI.
So we'd also like to mention our fellow co-authors who couldn't be here today. So Arjun Kumar, Jay Mastry, Ashmita Padma, and Shara Shan. So first we want to cover why is referral management important. So it's important because the first contact providers in the health process, such as primary care physicians and emergency services, are going to refer patients to further care providers to make sure their health is maximized, essentially. So the extent of and rapid communications of the referral is crucial to make sure patient health is maximized. So we've got two examples here. So the first example is a primary care patient with episodes of severe ab pain referred to further clinics. And the data being transferred is the patient names and the contact info and the referring physician. And then the second example is an accident victim being transported and referred to a trauma center. So in this case, the trauma center needs all the information upon arrival, so a patient file is created and shared with the clinic at the time of arrival. So now we're going to move on to talk about what's the current state of referral management. So currently it's very manual and inefficient because a lot of the process is done by the care providers themselves. So they've got to read the incoming faxes, contact the referred physicians, and then schedule the appointment manually. So what Satvik I and the rest of the team did is we created an AI process, as you guys can see here, which we're now in the process of implementing at a local clinic. So the first step would be the AI system intercepts the incoming eFax referral, then it discerns whether it's a new patient or not. So if it is, then it will create a data chart that's added to the database of all the referrals. And if it's not, it will use the previous data chart to create a task. And that task is to text the referred patient. And based on this database right here, the referrals will be ranked in order using AI in order from most urgent and most in need to least urgent. So then the most urgent referrals will be called 3 times. And if the patient is reached, then the appointment will be scheduled. And if it's not, then the system will inform the referring physician to ensure that the patient gets the help they need.
To move on, we're going to work on the AI automation will help all referral processes. So we're going to talk about how trauma patients referred can be triaged faster. So if we start off with the patient file, we'll take it in a PDF form, right? It'll be put in like a chat box Q&A by MDs and nurses to ask questions such as what is the patient's name, triagging information, what's their purpose of the visit, like why they're at the clinic, right? After that, it'll be put the triagging categorization, and then we'll be put in a process like should they be admitted or not. If they are admitted, then the patient will be admitted and care pathway document will be sent to the database. If not, it'll still be sent to the database, and the triagging will still be based on AI. Talk about next is what is the impact of referral management on population health? So we know that population health will improve with efficient referral management. That's the point of us. And then talk about efficient contacting and triagging. What it does, it increases the patient counts and revenue for providers. This indeed contributes to their financial stability and growth. Some health clinics we can talk about are Kaiser Permanente, integrating the EHRs to streamline referrals. Geisinger Health System uses a centralized office for these coordinated follow-up cares. Intermountain Healthcare, Mayo Clinic, and Cleveland Clinic, respectively, using data analytics, patient navigation programs, and seamless care transactions, all for stable providers and care access to improve these population health. This is all about improving the population health and efficient referral management. Next, we can talk about how can government use referral management for improving the population health. So we know that area agencies on aging, local health departments, and state Medicaid agency, they're playing a crucial role by providing patients their necessary information, tools, and support to get the healthcare that they need and deserve. And to add on, community health centers and state health insurance assistance programs, aka known as SHIPs, offer comprehensive services and guidance to ensure that the patient referrals are handled effectively. And this results in agencies and community organizations using the referral management to improve the Medicaid and Medicare population health management. To add on, these agencies use referral management to improve population health outcomes beyond Medicaid and Medicare. So the agencies use enhancing vaccination rates by integrating with immunization information systems to track and identify those needing vaccinations, enabling targeted outreach programs, implementing incentive programs, fostering community partnerships to address social determinants, improving care coordination between providers by providing data for decision-making. Additionally, they facilitate other public health initiatives, for example, EMS services, by incorporating the telehealth to reach underserved populations.
So of course, there's always challenges when using AI. So some of the challenges we looked at in terms of using AI for referral management is how do we incentivize providers and patients to use this system, especially when we want to get it to the commercialization stage, provider shortages, and then something that, of course, everybody here probably knows about, all the experts in AI, making sure the data is securely shared and the data privacy regulations are followed, especially HIPAA, which is very important in the eyes of the government. And then this is a more of an ethical issue, but how can you effectively prioritize patient need? Because that's a very subjective thing. And how can you create an AI system that reflects the wants of healthcare clinics? So overall, we genuinely believe that AI and machine learning can make referral management overcome challenges. For example, it allows clinics to discern which referrals are clinically urgent by using reason codes and notes. In terms of revenue for the clinics, it shows which referrals are more likely to result in appointments and which prospects are similar to current patients, so which prospects are more likely to come in and provide revenue for the clinic. And then which referrals are approved by the insurance and which insurance companies pay without hassle, so another revenue lens for the clinic themselves.
Overall, while challenges exist to apply referral management, agencies can use it effectively using data and AI. And we believe that agencies can build on recent referral management successes at providers and in their commercial sector. We already are working with a clinic, as we mentioned before. And overall, we believe that this sector has lots of potential. And we see like in the future that it can be something that's important. We'd like to end it off over there.
Any questions?
That's all. Always nice to meet a Duke student. I'm an alum from a long time ago.
Oh, nice. That's
So,
awesome.
It's a wonderful project too, and very well conceptualized. What are you thinking as far as how you're going to obtain a training and test data set?
Oh, so we've actually already started by asking clinics for like PDF information, right? So they've given us referrals, but redacted all the information out. So we've started out by essentially putting those into models and extracting information. And then we've also looked at the contacting side. So we've used the information from those PDFs and used a text messaging service to kind of simulate that process. So that's the stage we're at right now. We want to separate it into a couple stages. So first would be getting the information and sending text messages, and then adding in the rank ordered system, and then getting it to a stage where we could commercialize and scale.
Okay, thank you.
So I know you guys are working with one of the clinics. What are some of the challenges you guys are facing when you try to prototype these concepts, and what do you guys think?
A big thing is like outreach, contact, because it's hard to, of course, you got to propose the idea of deploying your AI system and have to make sure that they trust us with that kind of especially sensitive information, all the HIPAA laws, HIPAA regulations. So first thing is like gaining that trust, but also you have to make sure it works and implementing the AI model and making sure we can kind of effectively release it in different stages.
Well, a quick question. You had a really nice set of metrics on one of your last slides as to what a successful referral is. So would you need to label the referral data you're getting from a clinic as to whether each referral that they had in the past was somehow successful or not in order to train the model?
Yeah. Actually, I don't think we would need to label it, but it would be more like if we can effectively get the data out, because I think that's the main challenge we've had, get effectively extracting the data from the PDF and in terms of like text extraction. So if we're able to do that successfully, and I think that's our measure of success right now. And then we'll move on to outreach, see if the contact method we are using is successful.
Thank you. It's a wonderful project.
Thank you.